Well, in our book, The 7 Ways to Lifelong Sexual Vitality, Anna Marie and I address, at some level, the diseases that can be contracted from bodily fluid exchange. And what we never hear, but we know to be true, is that viral diseases like chronic fatigue syndrome can be transferred. HIV is a close cousin, so we already know that. So why wouldn't a very close cousin, a retrovirus, be able to be transferred? It does. So that should open a plethora of thought on this. And doesn't that mean bacteria can be switched? Of course. And doesn't it mean parasites can be? Of course. Doesn't it mean amoebas can be? And so this is a fact. This isn't an opinion we're talking about. When we have intimacy with somebody that we love, we basically often have oral sex. And what we do know is that the same thing that causes cervical cancer for women creates throat cancer for men. And so that's a done deal. That we know to be true, but is too seldom discussed. And you know, when you're in a time of passion and you're in love, you don't think about these things. And so we always should consider what we're doing and the history of the individual. Now, being in a monogamous relationship a long time doesn't mean it's going to protect you. Most of us have had partners or multiple partners before we were in that relationship. And you could be harboring one of these microbial problems for a long, long time without even knowing it. A lot of these microbes are sedentary. They sort of hang out there until you get weak, your immune system, you get under stress, you're not eating right, you're not sleeping, and bing, they bloom. And at that point, they bloom. Herpes virus, millions, tens of millions of people worldwide, hundreds of millions of people have herpes simplex in their genitalia. And I have cold sores. That's part of the same family. That's called a herpes simplex. Now, I have far less today than I had when I was a kid. It was 5 months a year. I had the cold sore. And less. Why? It's immunity. But it doesn't mean it goes away. And even when you eat the best food and you do the best of everything, some of these microbes are just going to be there forever. It's up to us to maintain such a high standard of health and lifestyle that we suppress them so they don't bloom. But it's no different for any other disease. I don't care if it's cancer we're talking about or bacterial diseases, etc. One part of this I'd like to discuss is antibiotic use. Now, where most of you get antibiotics and you don't know it is from eating animals and drinking milk from animals. 75 to 80% of all antibiotics manufactured on Earth by the pharmaceutical industry are used on animal husbandry. Isn't that amazing? And that's a weird word, isn't it? Husbandry. Well, what are we doing? We're killing them for food. And that's why we have so much antibiotic resistance. I commonly see young ladies, 7 years old, 8 years old, who are growing breast, who have actually menstruation, who are widely eating chicken. They're so riddled with antibiotics at this point, and other forms of animal-based foods. So you're having a problem with that to begin with, and that's a major contributor to the devastation of your bacteria, your biobacteria in your intestinal tract, which is your immune system. So not if this is happening, it's happening, and it's the vast majority of people, and this is not a joke, have a weakened and compromised immune system just from that alone. Now you go to the doctor, and the doctor is trained, rightfully, because antibiotics have saved billions and billions of people's lives, no question about it. The first thing they'll do is give you an antibiotic. Sadly, when you have a viral disease, they give you an antibiotic, and it helps bacteria. It doesn't help viruses. So now you're suppressing the immune system, and in some way reducing the bacteria count, the inflammatory count, and temporarily maybe relieving the viral, but it doesn't really directly affect the virus. There are things that do. So it's not never do it, that it should be prudent, it should be well thought out. The patient, you, have to be educated and knowledgeable around the world about these things. You have to go to a doctor who's not just gun crazy on giving you antibiotics every time you walk in, because the most antibiotics you'll ever get, as Anna Maria spoke in her program yesterday, is between birth and 2 years old. And by the way, that we were warned 50 years ago that was going to devastate whole generations of people, but it wasn't heeded. We didn't listen to that warning. So the answer is never absolutely no on this, but please try to avoid it. And every single year we send a lot of our guests back for antibiotics because it's the best choice in that situation. But we don't do it quickly and rapidly and unconsciously.